Hi, everyone. My name is Rhonda Gallant, and on behalf of HR.com, I would love to welcome you all to this webcast sponsored by AIMED Alliance, the state of migraine disease in the workplace. This webcast has been pre-approved for 1 HRCI credit and may also be submitted for SHRM credit, so please be sure to attend the complete webcast in order to receive credits. Those credits will appear in your HR.com account within 2 business days, and we will also send you an email with this information. So if you have questions or comments during the webcast, please, you can submit those by using the Q&A in your webinar controls and just type your questions in there. All right, it is now my pleasure to turn it over to Stacy Worthy.
Thanks, Rhonda. I'm Stacy Worthy. I'm with AIMED Alliance, and today we're going to be presenting the state of disease in the workplace. I'm going to be joined today by Wendy Baumfak, who's the Director of Operations at the World Health Education Foundation and Migraine World Summit, and Campaign Manager at Migraine at Work. Also joining us is Brian Gifford, Director of Research and Analytics at the Integrated Benefits Institute, and my colleague Shruti Kulkarni, who is also counsel to AIMED Alliance. Just a little bit about AIMED Alliance. We are a nonprofit health policy organization that seeks to protect and enhance the rights of healthcare consumers and providers. Quick preview of today's presentation. We're going to give an overview of what migraine disease is. We'll go over the results of our recent survey titled State of Migraine in the Workplace. We'll hear a patient story, and then we'll hear information about the productivity burden of migraine. So, overview of migraine. Migraine disease is defined as a collection of neurological symptoms, usually including severe throbbing head pain, often accompanied by other symptoms, including nausea, sensitivity to light and sound, and visual disturbances. Migraine headaches are typically called episodes or attacks, and these attacks may last anywhere between 4 and 72 hours. Migraine disease may be acute or chronic. And if it's chronic, it's defined as having 15 or more migraine headache or attack days per month, whereas acute is having fewer than 15 migraine episode days per month. There are a lot of different triggers for migraine attack, and those include the ones listed here: hormonal changes, drinks that include caffeine or alcohol, food additives, skipping meals, and so on. Migraine is the third most common disorder in the world, and in America, more than 38 million people have it. Also, according to the World Health Organization, it's the 6th most debilitating disease in the world. Employers have a vested interest in the health and well-being of their employees, and they want them to be able to show up and be productive. So it really is in their best interest to create a welcoming environment for employees with migraine, including by offering sufficient benefits and accommodations. Migraine impacts individuals during the majority of their working career. It's most common between the ages of 25 and 55, yet during a migraine episode, more than 90% report being unable to work or function normally, and 51% report that their productivity level is cut in half. Migraine can also result in significant financial losses for employers. So for example, one report found that $13 billion were lost from reduced productivity each year, and 113 million lost work days were due to migraine. So it is important that employers take steps to offer accommodations to mitigate the onset of migraine episodes and benefits to assist employees experiencing episodes. That way you still have very productive employees in that workplace. So we wanted to understand how employers perceive migraine disease, provide accommodations, and incorporate practices to help improve the chances of success for workers with migraine disease. And as such, we conducted this survey from July to October 2020. It included 309 respondents, and they were all US-based HR professionals in virtually every industry. We partnered with HR.com and the HR Research Institute to conduct this survey, and we got a broad cross-section of employers, from small businesses with 50 employees or fewer to large enterprises with over 20,000 employees. And with that, I'm going to turn it over to my colleague Shruti to discuss the first half of our survey report.
Hi, everyone. So let's start with some encouraging results. Only about 21% of participants reported that they lacked any knowledge about migraine disease. So this suggests that most have some sort of awareness about migraine disease and associated workplace challenges, even if they're not fully aware that migraine disease can be considered a disability. This is also supported by the fact that only 6% of participants believe employees who report migraine attacks are exaggerating or faking it, and even fewer do not consider a migraine attack a valid reason for missing work, 3%. Unfortunately, this knowledge does not necessarily transfer to direct supervisors, with 70% saying that they believe direct supervisors at their organizations lack knowledge about migraine disease. This shows a critical need for this disease education among direct supervisors. In fact, 35% of participants said direct supervisors at their organizations do not believe migraine disease is debilitating, compared to only 1% of HR professionals. And 39% said direct supervisors do not think migraine attacks are a valid reason for missing work, whereas only 3% of HR professionals said the same thing. This lack of understanding can perpetuate stigma as well as discrimination in the workplace, making employees uncomfortable to ask for accommodations that they may need. So we also looked at what is the likelihood of missing work. 75% of participants said that employees with migraine disease use paid or unpaid sick days, sometimes, very often, or always. Another 64% said employees are working through their migraine attacks at least some of the time. 27% of employees said that their employees use FMLA at least some of the times. Employees who cannot afford to take any unpaid leave may incur more stress, which can increase the risk of a migraine attack, which leads to this vicious cycle. And it also highlights the need to offer accommodations and comprehensive benefits in order to mitigate migraine triggers, as well as increase productivity. So let's look at productivity. Given the disabling nature of migraine attacks, productivity losses from migraine disease in the workplace have the potential to be expensive due to both absenteeism as well as presenteeism. Presenteeism is the issue where workers are unable, they are at their job, but they're not able to function fully because of their illness or some other medical condition. When asked about whether migraine attacks impair employee productivity, a large majority have said that migraine disease impacts employees' ability to work. 66% of respondents said employees suffering from migraine attacks sometimes have impairments, whereas 20% said that they often have impairments in their ability to work. Again, encouraging results because the majority of respondents acknowledge how debilitating a migraine attack can be. That left us hopeful that HR professionals and employers would understand the need to improve productivity by offering comprehensive benefits as well as accommodations. So we also asked HR professionals whether they considered migraine disease a disability. Nearly 50% agreed or strongly agreed that it was. Larger companies were much more aware than mid-size and smaller companies that migraine disease could be considered a disability. Close to 80% of larger companies knew this. These results highlight the need to educate employers and HR professionals not only to protect employees, but also to protect themselves from liability under the Americans with Disabilities Act. So it's important to note that under the ADA, migraine most certainly can be considered a protected disability. For it to be considered a disability, employees must both be a qualified individual and have a disability. Employees are considered a qualified individual with a disability in terms of so disability is impairment that substantially limits one or more major life activities, such as the ability to work or care for oneself. Major life activities include things such as performing, seeing, hearing, concentrating, thinking, communicating, working, things that very much affect people with migraine disease. An individual is considered qualified if he or she is capable of performing the essential duties of a job with or without accommodation. Essential duties are tasks that are fundamental to the position. It's important to note that not everyone with migraine disease will be considered to have a disability because disability is determined on a case-by-case basis. Employees can and should request reasonable accommodation, which is a modification or adjustment to a work environment. Accommodations must be provided to qualified individuals unless doing so would cause undue hardship to the employer. Something is an undue hardship if it can cause significant difficulty or expense to the business. However, majority of these accommodations cost less than $500. So for most employers, that makes them reasonable and easy to implement. Reasonable accommodations can include things that limit migraine attack triggers, such as alternative lighting, noise canceling headphones, as well as anti-fragrance policies. So while employers may be required to offer accommodations, employees may not be comfortable asking for them. Our survey found that employees appear to be far more comfortable asking HR professionals for accommodations than their direct supervisors. This is partially because HR is less likely to have negative views about migraine disease. This also may be because direct supervisors are in more of a position of power, and some employees may fear negative consequences, such as being denied opportunities for advancement or even possibly being fired. This lack of comfort asking for special accommodations might become a serious and complex diversity, equity, and inclusion issue for employers, especially considering that women who experience migraine attacks far more frequently than men are already underrepresented in leadership ranks. The reality is that many employees will not get accommodations unless they ask for it, and failing to ask for it could result in this vicious cycle. That is, those who do not get the accommodation they require may have more migraine events in the future and therefore need to take more time off. Some organizations could also potentially avoid this loop by becoming more proactive rather than reactive when managing their employees with migraine disease. We also asked participants how likely their organization is to make changes in the workplace to reduce the risk that an employee will have a migraine episode. Only about 17% say that is very likely, although another 32% said that it's somewhat likely. Nearly a quarter, however, say they just don't know. So there's clearly a room for improvement here. Just about half, 56% agree or strongly agree that their organization does a good job at helping and accommodating employees. This still leaves a large proportion of HR professionals who are either not certain about whether their organizations can accommodate or that actively disagree that they do. According to survey respondents, also, the most common accommodation offered today is flexibility in schedules and breaks. This flexibility can help minimize stress, often a trigger attack, as I mentioned previously, and can also help employees, not just those, help all employees, not just those with migraine disease. About half offer the ability to telecommute. Studies have shown that telecommuters have 25% less stress, and 80% say telecommuting helps them maintain their work-life balance better. Accommodations can also vary on an employee's individual needs. For example, employees may require a different desk or chair, access to a quiet room, alternative lighting, as I mentioned before, anti-fragrance policies, noise canceling headphones. A majority of these accommodations, like I said, cost less than $500 to implement. With that, I will have Stacy continue with the rest of the survey.
Judy. So now we're going to talk about health benefits. And it's very important for employees with migraine to have wide access to a variety of health benefits. they may need different services, such as different types of medication, diagnostics to rule out other conditions, eating and nutrition counseling specialists, and treatments for comorbidities such as depression or anxiety, among other things. Yet, health plans commonly impose overly burdensome cost containment requirements that limit access to migraine treatment and services. And the most common ones being the ones listed on this slide. So first is step therapy, which is a policy that requires plan enrollees to try and fail on a medication before they can access the one that's prescribed to them. Prior authorization is when the health plan requires the provider or the enrollee to obtain the plan's advance approval before allowing the prescription to be filled or the medical service to be provided. Mid-year formulary changes are a negative formulary change that occur after the plan year has begun. So that could be dropping a medication from a formulary or increasing out-of-pocket costs, placing the medication on a higher tier, things like that. Copay accumulator plans are policies that exclude the value of copay assistance toward the calculation of a plan enrollee's deductible or maximum out-of-pocket limit. So if the patient is getting copay assistance from a drug manufacturer in the form of a coupon, that wouldn't count towards their deductible. And then quantity limits is limitations on the number of pills that a plan enrollee can receive per month. So many employers responded that there are limitations in place. Regarding quantity limits, 21% said that there were quantity limits in place. And because migraine episodes can be unpredictable, these types of restrictions are challenging for those with both chronic and acute migraine disease. Employees can't predict how many pills they're going to need because they don't know how many migraine attacks they're going to have per month. With prior authorization, about 22% said they have prior authorization restrictions in place. Yet prior authorization requirements can be harmful because patients can be harmful to patients because they overrule the healthcare practitioner's judgment and delay access to necessary care. 14% said they believe that the plans impose step therapy, and step therapy can be frustrating because it's typically a one-size-fits-all approach and it doesn't take into account the patient's history. These policies can force patients to fail on the same medication more than once and can cause disease progression or relapse by delaying access to that needed treatment. 7% said that their plan imposes a copay accumulator program. These programs can cause harm because copay assistance typically runs out pretty quickly. And once it does, patients may not be able to afford their treatment because they're still in that high deductible phase of their plan. And oftentimes they're unaware that their plan has implemented a copay accumulator. So they get stuck with what we refer to as the copay surprise at the pharmacy counter. Another 7% of participants say that their plans allow for mid-year formulary changes. And the problem here is that employees may lose coverage of a drug mid-year, and their drugs can cost more than they can afford, possibly increasing other medical expenses. If they can't get their medication, they might have to go to the hospital or have to see a doctor more frequently. And yet, they're locked in for the remainder of the plan year, so they can't find another plan that offers coverage of their treatment. It's important to note that for a lot of these questions, a large portion of respondents answered that they just didn't know whether these restrictions were imposed, highlighting the need for education. In all actuality, the use of these restrictions are likely much higher than is reported here. Respondents just may not have been aware that their plans impose these types of requirements, and also highlights the need for HR professionals to become familiar with their health plan criteria and consider advocating for plans that offer better access. Employers do have the ability to negotiate plan terms, and improving access can save money in the long run. We also asked HR professionals about which tactics they would implement if they believed the tactics could reduce costs and help employees with migraine disease. 49% said they would assist those seeking to appeal an adverse benefit determination, and 45% said they would assist those seeking an exemption from some of these cost containment strategies. And these are great findings, and providing employees employees with expert assistance is likely a role that many HR professionals are comfortable with. Other tactics, however, were much less common. So only 12% would remove quantity limits, just 6% would limit prior authorization, and only 5% would limit step therapy. And we suspect that many HR professionals just may not feel that they have authority to easily remove these types of limits. However, they can advocate for this type of change. It is likely helpful if you survey your employees and find out if these limitations are causing problems for them and figure out how you can help them. 72% of employers reported to offer an employee assistance program, or EAP, to help support employees with migraine. And one of the advantages of an EAP is that there's typically no cost to the employees and family members for assessment and short-term counseling. Other services such as migraine management programs and migraine training and education for employers and employees were far less common. However, they can be very helpful to ensure proper diagnosis and treatment and reduce stigma in the workplace. So targeting the respondents whose companies do not offer the types of support that we highlighted, we asked, in the future, which support do you think your organization would be inclined to offer? And it was a hopeful sign that 44% said they would be inclined to offer migraine training and education for employers and employees. So to take a closer look at what differentiates organizations with effective migraine management processes from those with less successful migraine management processes, we separated our sample into two separate cohorts. The first being migraine management leaders, and these were respondents who strongly agree that their organization does a good job at helping employees with migraine disease. The other was migraine management laggards, and that's respondents who strongly disagree, or neither agree nor disagree. So what do the migraine management leaders do differently? Well, they were more aware that migraine disease can be considered a disability. Employees were more comfortable discussing accommodation with HR as well as with their direct supervisors, and they do a better job of encouraging open lines of communication and nurturing a company culture that embraces and values collaboration and empathy. And as a result, employees were more likely to feel supported and request accommodations from HR and direct supervisors. 73% of migraine management leaders are much more likely than others to provide employees with health insurance that covers migraine disease. And this group likely realizes that migraine disease is often associated with other mental and physical health issues. And perhaps because health insurance can be so confusing, 38% of migraine management leaders also provided more patient navigation services. And finally, leaders are more likely to have health insurance policies with fewer prior authorization and quantity limit restrictions, making it easier for employees with migraine disease to get the treatment that they need. So just to conclude, I wanted to give a couple recommendations for organizations that seek to be migraine management leaders. And that includes creating a training program to educate managers about migraine disease, associated stigma and disability law, reviewing the organization's culture and updating it if necessary, reviewing benefit plans and wellness programs, considering a migraine management awareness campaign, taking actions to minimize stress in the workplace, providing personalized accommodations to those with migraine disease, staying up to date on regulations, policies, and procedures, and incorporating non-stigmatizing terminology. And that concludes our portion of the presentation. With that, I'd like to turn it over to Wendy.
Great, thank you so much. I'm Wendy Bohnbalk, and I just wanted to first of all thank HR.com and AIMED Alliance for inviting me today to share my story about living and working with migraine. Next slide. So I started with my career back in the early 90s, and I even have a picture here to prove it. So that's probably a little embarrassing, but I started at the time, Accenture was known as Anderson Consulting. And if you'll go back a slide, that'd be great. Thank you. I started in consulting. I traveled a lot. I was on a great career path, made manager. Back then, some things were very typical about this type of work environment and culture. And looking back now, so many of these things were migraine triggers, some of which Stacy has and just pointed out actually, but we worked extremely long hours. We had small little computer screens. We had very bright fluorescent lights. Perfume was very common, strong smells, colognes in the workplace. Again, many of which were migraine triggers. Around 2000, I wanted a change in career and I moved into HR and recruiting where I found my passion. I loved my job. Unfortunately, I started getting migraine attacks. At first, they were really just annoying, but then they really started to affect my days. About the same time, I got married and then soon after was officially diagnosed with migraine. Little did I know then how that would change my entire life. Next slide. So I thought it'd be interesting to put a graph together to kind of show my different trajectories, with regard to my career versus migraine versus building a family. So careers there in green. And as you can see, kind of all those things were I'm off to a great start, or my career and family building were off to a great start. I had a sharp trajectory with work and, was building a family. Unfortunately, my migraine trajectory was also going up. After I was diagnosed, I held things together for a few years. I had my first child in 2005 and elected to work part-time. I had a second child in 2008. I had hoped to go back to full-time work, but migraine had a different path in store for me. It's interesting for me to look back now and see that intersection point where things really went south. I didn't recognize it at the time. I think intervention then would have been key. So, if you'll see, that was around probably 2009, where my career was leveling off just a little bit as I had moved to part-time, but my family was certainly building and migraine was becoming very intense. I didn't recognize it, like I said, at the time, but looking back, that would have been just a key point at which I could have intervened and done some things differently. My attacks were getting very severe, often daily. Next slide. So this was supposed to be my prime years. I was in my mid-30s. I had a great career. I loved my job. I was building a family. But unfortunately, this is so often when migraine strikes, especially with women. I was struggling. I put a picture of myself here. You guys don't know me, but at the time when I'd get finished with a work day, my husband would look at my eyes and see if I had what he called dead or crazy eyes. And in this picture, I can actually see that just dullness across my face. There are whole periods of time I just don't remember. I was doing everything I could to survive. I averaged about 18 migraine days a month, but felt some kind of symptom, whether it was brain fog or stomach or something, pretty much every single day. I ended up opening up to my boss. There was a great deal of trust there. And she was very supportive of me, of my working flexible hours. I worked from home, but work, unfortunately, was still very triggering. For one role in particular, I was flying back and forth from Charlotte to Washington, D.C., overseeing recruiting for a very large engagement. I was supposed to run meetings with partners, determining which talent we wanted to bring on board. I remember distinctly one of those biggest meetings, with 30 partners in the room. And at the last minute, I had a migraine attack, had to run to the bathroom, couldn't leave the bathroom for the remainder of the meeting, had to turn that over to a coworker very last minute. And there just got to be a point where this wasn't doable anymore. Next slide. In 2010, I took a health leave of absence for 2 months. Leaving work actually did help me tremendously. I was able to, get my stress level down, have the right kind of lights, stop staring at a computer screen. I really worked on my lifestyle. I went back to work for a few months and then unfortunately was right back where I started. I should note that my company was extremely accommodating to me. I was working from home. I actually moved into a less stressful job. They really wanted, I think, to help me be successful. But and them, along with so many organizations, were very committed to keeping senior level women in the workforce. And I felt that. But back then, unfortunately, neither they nor I knew what to do in my situation. So I took another leave. This one was a 1-year unpaid leave of absence. With much anguish, I ended up quitting in 2012. And you can see there, that's kind of when my career was just flatlined. My family, I kind of kept them, steady at level 8 there, but I think we all know with families that there are plenty of ups and downs there too. My head did start to improve, but I had lost so much of my identity, and was just kind of floundering. It was, again, a very dark period in my life. Then I found advocacy in 2016. And during that time, I wrote down my migraine story. I realized it kind of sunk in that my doctor might not have all the answers, and I tried to figure out how to help myself. I did a very deep, deep dive into migraine. As a political science major, policy was of interest, and actually you can go to the next slide now, Stacy, thank you. Policy was of interest to me, and I participated in a lobbying event called Headache on the Hill. My son and I were interviewed for NBC Nightly News in 2017 about migraine in children, and I participated in a Miles for Migraine event. These things were great. They were certainly helpful to me getting back on my feet, but I did need more. Next slide. I experienced a breakthrough in 2018. An organization I had long admired offered me a job with the Migraine World Summit. I was nervous to rejoin the working world, very nervous, but my worries were unwarranted. I'm very fortunate to work for a migraine organization where they walk the talk. Health absolutely comes first. But I've also just learned so much about managing my migraine disease, including how to thrive at work. Most recently, I've taken on a leadership role with a campaign called Migraine at Work. And I really just want to help more people stay healthy and stay employed. There is so much that we have learned about migraine and treatments and new care that's out there, and learned about migraine in the workplace to help with this, including this great survey and results that Aimed Alliance just did. Next slide. So here's I guess just an image. Stacy certainly talked about this during her part of the presentation, Trudy too. But how does work impact migraine? Here's just an image of that. Some of the things that are particularly detrimental. Unfortunately, work environments do trigger often and exacerbate migraine attacks. So bright lights, really stressful jobs, staring at a computer screen for long hours, working those long hours, maybe having a poor diet as you're rushing around. Bad smells, having bad posture, sitting in a bad chair, and that affecting your neck and back as well. As was said, 90% of people with migraine cannot work, at least not work well during an attack. I was definitely one of those people that tried to power through, with my milder attacks, and that's called presenteeism. It's not particularly effective. So what do we do? Next slide. So looking back, knowing what I know now, I wish I could go back to that inflection point. There are so many things I could have done differently. I think I could have saved my job. And that would be in combination with lifestyle changes, but, just little things. And if you go back a slide, great. So those fluorescent lights are just, horrendous for anybody, but, being able to work in a space without those is super helpful. If you do have to be there, there are special glasses you can wear, or sometimes even sunglasses. But staring at that computer screen, you can put on an anti-glare guard. You can wear glasses, special glasses to look at the computer screen. Get a better chair. Don't sit there like I was, hunched over. That's me in the front right, by the way, just to point myself out. I think that's actually after a long day that we had been working, gone to dinner, and then come back to work, which was kind of typical back then. But having a larger monitor, I used to stare at reports all day long, at little fields on reports, and just even having a large monitor has made a huge difference for me. Take breaks, move around, hydrate, have a better diet, really work in those lifestyle factors has also made a tremendous difference for me. And then where possible, being able to work flexible hours, work around attacks, work from home, those things are very helpful. Next slide. So why your company should care? Over their lifetime, 20% of Americans have experience with migraine disease. Half of people with migraine are not diagnosed, but it can cause a huge reduction in productivity. Employees with 10 plus headache days a month, which are getting close to that chronic mark, can lose between 48 to 91 days of work each year. Certainly, there's often stigma involved with migraine when people don't understand it, or don't understand when people, have to leave work suddenly or just have these headaches. It's not a very well understood disease. Sometimes this lack of understanding does also go along with your relationship with your boss or your manager or HR. And if you kind of can't explain or don't have that trust that you can explain things, and it often can result in employee turnover. And then this is just a rhetorical question, but I'm curious, how many of you here today have worked with a migraine attack? I mean, so many of us are actually familiar with that. With migraine at work, I've been so lucky, again, like I said, oh, there's one person actually, I appreciate you speaking up, but it's extremely common, unfortunately. With migraine at work, we're trying to get educational resources into the hands of employees and employers. I personally have gotten so much of my life back. I'm on a different path than I probably once thought I would be on, but it's an incredibly fulfilling path. I've been able to re-enter the workforce, and I really just want to do the same for others. Awareness and education is key. And by the way, thank you for all of you that are raising your hands. That means a lot to me that you would do that. But awareness and education are key. Please do feel free to contact me or check out migraineatwork.org with any questions. Last slide. So here's to a better 2021. That's me with my grown-up boys now. And unfortunately, both of them have inherited migraine disease, but I feel like I'm in such a better position to help them manage their disease that I know they're going to have long and fruitful careers. Thanks.
Thanks, Wendy. I apologize for the slides advancing. Next, we have Brian, who's going to talk about cognitivity burden of migraine. So Brian, take it away.
Thank you very much. I appreciate the opportunity to be a part of this panel. It's been interesting to look at the different stakeholders in the issue of migraine here. So we started off with that view from the HR and benefits world and what they know, what they should know, what they need to know. And then, of course, Wendy's story about what it's actually like to live and try to manage a career and a family while you have migraine. So I'm going to, my agenda today is to bring you information relevant to a third set of stakeholders, and that would be business leaders. So today I'm going to be talking about, for example, the cost of migraine in the workforce. And I'm going to talk about that specifically with regards to healthcare, absence, disability, and so forth. But I'm also going to talk about the performance impact of migraine. We've heard a little bit about presenteeism. I want to go a little bit deeper on that and just say a little bit more about what that means in practice, and of course, show some evidence indicating that how people can perform better when they have migraine, when they have a history of migraine, such as Wendy does, but comparing when their symptoms are well managed compared to when they're not. Okay. Now, I don't want to leave anybody in suspense, so I'm just going to give you a summary of the numbers part of the discussion today. So from the research that the Integrated Benefits has done, we found that migraine is going to cost about $84 per employee per year in what I'll call excess healthcare treatments and lost work time. And by excess, I mean that's compared to people on average who don't have migraine. And I also want to emphasize that this is per employee per year, not per migrainer per year. And that excess healthcare treatments is going to include treatment for anything that a person might have. So this is all-cause healthcare treatments. It's also all-cause sick days and any disability leaves for headaches, for migraine, and so forth. I want you to understand as well that when I talk about those costs, we'll think of those as the hard cost, the direct cost, as some people would like to say. It's an undercount. It's an undercount in terms of the cost of, or what a company loses when people are not able to put in their best performance on the job. It's the cost of losing that experience and that institutional wisdom when somebody exits from the labor force, and this cost of replacing people. So the numbers I show you, remember, they're not close to what's probably really going on out there and impacting businesses. One of the ways we'll try to backfill that is with this issue of presenteeism, underperformance on the job, specifically due to migraine. And of course, the big finding here is when we start to model in both the number of people who have migraine and its impact, and it might be a day in and day out impact over the course of an entire year, that's going to be about $142 per employee per year, more than healthcare treatments and lost work time combined. Okay, but so that's kind of the big level overview. The other thing I'm going to go over is that, when I hear the term presenteeism, I know that that's not everybody's cup of tea. It's not necessarily mine either, because that doesn't say a whole lot. It's just a comparison on average over time. I would prefer to look at performance on the job in a much more targeted way. So for example, can people concentrate at work? Can they work carefully? Can they do high quality work? And a second study that I'm going to talk about, we find that people who have a history of migraine or severe headaches, they report more difficulties with all of these things. But when we apply a statistical control where we're able to account for the frequency of their headaches, in other words, when we are able to simulate what their life is like when they don't have headaches compared to when they do, all of that difficulty at work compared to people who don't have migraine at all goes away. And this is really consistent with that idea that a well-managed symptoms are actually the key to preserving productivity. Now, why did we do this study in the first place? It's because we are IBI, the Integrated Benefits Institute. We've been around for about 25 years, a nonprofit organization focused on workforce health and productivity. And basically our core message is that everybody knows illness has costs, and we'll always focus on how health creates value. And it does that by helping people be on the job consistently, putting in a good performance, doing all the things that make a business, and not just looking at the healthcare spend, for example. So let's move on really quickly to what I'm talking about when I say the costs of migraine in the workforce. I'm really thinking about medical and pharmacy costs, sick day costs, short-term and long-term disability, and then of course we'll bring in presenteeism as well. So one of the things before I jump into those numbers are, let's just understand that the data we analyze, these come from the Agency for Health Research and Quality, part of the United States government. And what we find, of course, and this has already been alluded to, by the previous speakers, is that people really are, if they have migraine or if they've been diagnosed with migraine and they're reporting that, the treatment levels are so much further below that. Okay, just in terms of what we can see from the healthcare claims database, for example, or the insurance database. So when I get to the end of guidance, keep this finding in mind when people are thinking about, I've heard these stories, I understand, I need to know more about who has migraine. So far, claims analysis is probably going to vastly undercount how many people are actually trying to deal with migraine on the job. When we look at the costs of migraine, let's start off, we'll build this story as we go. So think about, again, excess medical and pharmacy treatments. This is all the healthcare that people consume, the cost of all of that compared to people without migraine. And so this is going to be, for an entire workforce, about $61 per employee per year for people with migraine. And I'll tell you right now, I've sat in on an employer advisory board where their representatives from companies are really concerned about, for example, an expensive pharmaceutical for a really small number of employees, or a really small number of people who actually have it. So think about hemophilia, which might cost hundreds of thousands of dollars per year, but because so few people have it, we might be looking at $14 per employee per year. But when you ask them about, are you concerned about the high cost of migraine? Very little concern at all, because it's really hard to think about these dribs and drabs of this combination between these marginal costs, but a lot of people with a condition, it really does start to add up. It adds up not just in healthcare spend, but it also adds up in excess sick days. So again, if you're not really noticing a day here and a day there compared to people who don't have migraine, it does add up. So if we just add in the sick day cost, now we're up to almost $80 per employee per year attributable to migraine. And then when we add in, finally, the short-term disability and long-term disability claims for migraine, Shruti already mentioned this, and benefits directors are right. People don't take disability leave for migraine all that often, certainly not compared to back pain, certainly not compared to mental health conditions, and so on. But as Wendy talked about, this is still an important indicator, because people who are taking short-term disability for migraine, in IBI's analyses of its own claims experience, they're probably on their way out of the workforce, maybe temporarily, maybe permanently. So again, it's not just the volume you want to talk about, it's the impact on people's working careers and how that plays into an employer's ability to basically be a business with the people that it hires. And finally, we'll talk about this issue of presenteeism. I've told you the big number. $142. This is going to bring us the total migraine cost annually of $226 per employee per year. But I leave that out there, presenteeism. This is technically just that performance decrement for people with migraine compared to people without migraine. And again, it's a small day-to-day decrement overall. We know that on some days, though, people are going to perform very well. Other days, migraine's going to hit them, and they're not going to be able to perform at the level that they expect of themselves, and their employer expects of them as well. So this is one of these mathematical computations where lots of people go into work every day with small decrements in their performance. It starts to add up. A lot of people don't find that really compelling. What they'd rather see, and frankly, what I'd rather see, is a way of talking about performance on the job that is a little more qualitative, and that's neutral. So for example, if we talk about job performance as people working carefully, people putting in a high quality of work, people concentrating, I can't think of any employer, I can't think of any operations manager who's going to say these things are not important to a person's ability to contribute on the job, and that anything that gets in the way of this, we just don't even care about it. So we did an analysis of some of the data. I'll talk a little bit more about the data, but we did an analysis of about 32,000 employees, some of whom had migraine, some of them who probably had migraine but had not been diagnosed yet. And we really just wanted to see how they responded to questions about those kinds of performance measures I just talked about. And what of course we expect is that people who experience migraine are going to have worse job performance, but that's going to be a function of the frequency of their headaches, the intensity of the headaches as well. This is the kind of thing that's so obvious that we probably never even talk about it. Of course, it has to do with people experiencing episodes of migraine. But what we can do statistically is, since we also have information about people's frequency of migraine, once we model that, we would expect this association to go away. In other words, we don't think that people with migraine have more difficulties on the job because of their history of migraine. We think it's because of the headaches. Manage the headaches, and you've managed the performance on the job. Again, we got these data from the World Health Organization's Health and Productivity Questionnaire. We were given these data by the designers of the survey at Harvard Medical School, 32,000 employee surveys, questions about all kinds of different chronic conditions, all kinds of different symptoms, one of which was migraine, the one we're most interested in. And all we really wanted to do was look at how they answered those questions about performance. Okay, and the study's available on IBI's website if you're interested in ordinal logistic regression. Heaven help you. At any rate, so here's what the big finding is. Now, we separated our sample into 3 groups: people who didn't report any headache history, neither frequent nor severe nor migraines, and we looked at how many of them are reporting low performance on those 3 different questions most of the time. It's probably another webinar why 10% of people with no migraines are reporting low performance most of the time. But understand that people who have migraines or frequent and severe headaches are reporting a much higher incidence rate of low performance. Okay, and this is exactly what we'd expect. And these 2 groups, frequent and severe, are they're so close to each other that I suspect that a lot of these people with frequent and severe headaches actually have undiagnosed migraine. But if we look at the next slide, the difference between it all goes away once we again apply this adjustment for how often they have headaches. So this is a way of saying that if we take the people with a history of migraines and we're able to find them in a 30-day period, for example, when they don't really have that many migraines or when they don't have that many headaches, their performance is just as good as anybody else. It's as if they don't have a history of migraine in any case. Okay, so this is the kind of evidence that really indicates that well-managed conditions are really the key to preserving health and productivity. We found this with other illness symptoms, of course. For example, looking at psychiatric distress, looking at gastrointestinal symptoms, looking at flu-like symptoms. Of course, they all kind of had this same pattern of helping people perform better on the job, but none of them, except for headache frequency, explain the entire difference between people with migraine and people without migraine. Now I want to move quickly so we can get to the Q&A. Some of this information has already been presented, but let's just go over it a little bit. Second of all, here's the challenge with migraine. We've talked a little bit about it. There's lots of treatment options. It's often really hard to figure out what might be causing migraines for any particular person, and then you have to start thinking about what has been their history of treatment, what have they done to try and mitigate this, what's worked, what hasn't worked. I'm not going to go too far into that. What I do want to draw your attention to is there aren't a lot of studies that really look at the productivity benefits of specific kinds of interventions, such as triptans, such as prophylactic theory, but they're out there. And when we do see these studies, including one that my colleague Betty Zong and I published on accommodations, we do find that there are lots of benefits to getting people the right kind of treatment at the right time. And these benefits, again, we know they pay off for the employees, but we also want to emphasize how they pay off for employers. Okay. And again, I'm not going to spend a lot of time on the general guidance for employers. We've already seen two really good instances of what people should be thinking about when they're thinking about migraine in their workforce. The one I'm really going to emphasize here is, how do you understand how many people have migraine in your workforce? And how do you understand whether or not your benefits are actually designed to give them the maximum opportunity to contribute on the job? We saw Stacy's presentation. A lot of don't know responses about benefit design. So again, if we try to close that information gap, both about how many people have migraine, and again, I would argue that you don't necessarily want to focus just on your healthcare and disability claims for migraine medications. You're probably going to be undercounting quite a few people. But think about that, and think about whether or not you actually have the right mix of policies, whether these are pharmaceutical policies, formulary policies, accommodation policies, and try to leverage those for the best success of the business and make the business case based on the business, not necessarily on costs. Stacy, that's my thing.
Wonderful. Thank you so much. You did a wonderful job. Thank you to both Brian, Wendy, and Shruti. And we are going to move on to the Q&A. First, we just wanted to quickly thank our sponsors today, which are Amgen and Novartis. And then I want to also provide you with our contact information, just in case you'd like to reach out to any of the speakers today. So here's our contact info. But let's go ahead and look at the questions and see what we have here. Okay. So will we have access to the slides after the presentation? Yes. Let's see what else. How do you get employees to come out and say they are experiencing this illness? And this question is to all panelists. So I'll start. I think under the Americans with Disability Act, you cannot just ask somebody if they have migraine disease. I'm sure you know that that's protected, but you can create a welcoming environment. So you can let people know that you are offering benefits for individuals with migraine disease, and let them know that you're open to providing them with assistance if they feel comfortable coming forward. Wendy, Brian, Shruti, do you have anything else you would want to add?
Sure, I'd be willing to give a couple of thoughts on this. One is, tread lightly. I think there needs to be trust there, or you need to be talking maybe first to an HR person, like you saw in the survey results as well. But if you do have that conversation, I think you want to make it a partnership with your boss and talk about the things you can do and the ways you can be flexible, and you can you're working on things to make yourself the best employee that you can be. So, offering up ideas for how to make it work, I think goes a long way too. But it's difficult. I think, of course, having an environment where ideally there would be migraine programs, or there would be education about migraine that's already being offered, would certainly make it a much more conducive environment to the employee.
I would also say, and Wendy would have firsthand experience with this, that individuals in a workplace, there seems to be a way of them finding one another. So people with migraine will compare notes. What are your triggers? What has worked for you? And I would also say that at a high level, If through, for example, benefits partners, employers are collecting information, aggregate information, not on individuals, but here's how many people actually suffer from migraine, and here's how it says that, here's how they say it impacts their ability to work. I think by sharing that information widely could play a role in this destigmatizing process. One is it shows that you're not alone and that the one or two people you're in contact with really just scratches the surface. And the other is it's not your fault that you have difficulties on the job, and that there are ways of showing that when you are able to manage your condition, when the incidence of headaches are under control, your performance is as good as anybody else's. And I think that that would go a long way towards the destigmatization of this condition. You would say the same thing for other things such as mental health conditions, such as pain conditions, and so on. So that may be the place to start, is just being open and honest about what you're finding in your own workforce with the rest of the employees.
Absolutely. So we just got a question in. How do you recommend negotiating lighter treatment restrictions with insurance companies? I have migraine and have experienced step therapy, prior authorization, and quantity limits with my prescription just this week. So I think you could go about this a couple different ways. You could make sure that your health plan has a clear and accessible, easy exception process, so that if individual plan enrollees need exceptions from step therapy, prior authorization, and quantity limits, they can request it. They can get the provider's assistance to fill out the paperwork. It's processed very quickly, and then they get access to their treatment without these restrictions. The other thing to do would be to negotiate directly with the insurer to reduce some of these limitations. So you could require that the insurer have deadlines for prior authorization, for example, so that they have to respond within 24 hours if it's an emergency, or 72 hours if it's not an emergency, that they have to accept forms electronically and not by snail mail, because that can cause delays as well, that with step therapy, that they're not requiring you to try and fail on the same medication more than once, or that if they approve a prior authorization, that it's for an entire year, so you don't have to keep getting the same prior authorization over and over again, things like that. And if you're interested, there are some resources on AIMED Alliance's website. Definitely feel free to contact us at policy@aimedalliance.org. I can give you more recommendations on best practices to make these policies less burdensome. Anybody else have anything they wanted to add? Okay, well, I think that's all we have. I do want to make sure that that Rhonda has time to give her codes and everything. But thank you all for joining us today, and thank you to our speakers as well. Really great presentation. So everyone have a good afternoon.
Thanks, Stacy. Yes, excellent presentation. Lots of great comments coming in there, very valuable information. And I personally want to thank Wendy for sharing her story, finding her purpose, it seems, and that's just wonderful to see and helping so many. So thanks, Wendy. Your feedback is important, folks. It's important to us and to the folks at AIMED Alliance. So a survey is going to open in a new browser as I close the session. So please just take a moment to fill out that exit survey. Also, if you'd like to view this again, it will be archived on hr.com, and your credits will appear in your hr.com account within 2 business days, but we will send you an email as well with that information. All right, I think that's it. This concludes the webcast. Again, thanks so much to the folks at AIMED Alliance and all of the presenters, and take good care, everyone. Bye now.